Hi, I am George Razai. Launceston has one of the highest rates in Australia of chronic health problem. This figure shows the rate of diseases in Australia in blue, Tasmania in green, and Launceston and northeast of Tasmania in red. As you can see, the rate of diabetes is the highest in Launceston region. We have also the highest rate of heart disease, the highest rate of stroke, chronic obstructive airway disease, asthma, kidney disease, and cancer. We have also the worst cardiovascular risk factors. As you can see, the rate of hypertension in all states, Tasmania in red and Australia in green. And as you can see, 27% of people have hypertension. We have also the highest rate of overweight and obesity. About 71% of Tasmanians are overweight or obese. And nearly 35% are obese compared to the rest of Australia. Unfortunately, the problem is often treated as an issue of personal responsibility, with calls to encourage people to eat healthier diet and exercise more. Australians today eat too much food that is high in salt, do not eat enough vegetables and fruit, and drink high sugar sweetened drink and diet drink, and get less exercise. 91% of Australians did not eat enough of recommended vegetables, which is 5 serves per day. And 55% did not eat enough fruits, which is 2 serves per day. And 53% of Australians, they drink sugar sweetened drink or diet drink at least once a week. More importantly, Launceston and Australians are less physically active than they used to. Nearly 75% of people, they don't meet physical activity guidelines, which is at least 2.5 and 5 hours of moderate exercise a week. Our environment, which includes not just building, but also roads, sidewalks, and public spaces, play an important role in physical health, and therefore city planners should pay particular attention in helping residents to lead healthy lifestyles. Unfortunately, the layout and design of Launceston is too car-centric and has hindered healthier lifestyle choices and promoted sedentary lifestyles and poor diet. The recent design of the city centre is an example where installing many benches have made exercise unnecessary. Our lifestyle is encouraging people to eat more fast food and sit in car rather than walking and cycling. But one important issue is lack of fresh food, because we have limited option of places to get good and nutritious food. Therefore, city planning need to make it easier to create and sustain the production and sale of our fresh, local, nutritious foods such as vegetables and fruit, by supporting and promoting community gardens, urban gardens, and farms. We need also to pay particular attention to increase physical activity by making it easier and safer for people to walk and cycle. Providing more walkable spaces, better protected bike lanes, and more recreation spaces are important space. Using public spaces in city as places where people can exercise promote equity, rather than allowing physical activity to become restricted to private gym, which is often expensive. The changes encourage residents to walk more and get more exercise. Longevity studies show that people live the longest in environments where physical activity is part of daily life. Therefore, integrating better diet and more physical activity into everyday life can help Launcestonians to become healthier more effectively and at low cost. Another important issue is that Launceston suffers from one of the highest rate of chronic health problems. Chronic lung diseases. It's well recognized that chronic exposure to air pollution can lead to chronic lung diseases. It's estimated that 7 million people die in the world because of air pollution, which takes on average 3 years of the life expectancy of each one of us. The impact of air pollution had added significant due to recent rapid spread of COVID-19 pandemic. Moreover, the level of air pollution is increasing every year because of traffic congestion. Transport is a major contributor to air pollution. Unfortunately, our society is increasingly more reliant on cars, with 20 million vehicles registered in Australia in 2021, and nearly 26% of them are diesel cars, while electric cars account for only small proportion, 0.1% of the registered vehicles. And Tasmania's love affair with cars is growing. More than 500,000 cars have been registered in 2021. That's 79% increase from 2010. And Tasmania has the highest number of cars per population and the oldest cars. All of these contribute to traffic congestion and air pollution, and therefore increased rate of chronic lung diseases, including lung cancer. Now you can get lung cancer without smoking. The best and healthier option is to encourage people to walk, cycle and use public transport. But we need to make public transport more efficient, reliable and affordable. Many people are interested in getting electric car, but the concern of cost and whether there will be access to charging station prohibits many people from choosing low carbon option. We need to have a transport vision to reduce traffic congestion and air pollution. For example, we need to consider now about having the Eastern Bypass or Ring Road to reduce traffic congestion into the city centre. We should also look at alternative way of transport, like having a ferry on the Tamar River between, for example, Ghana and Launceston. There is therefore urgent need to reduce air pollution in our city to protect our health and prevent future diseases. Government, politicians, mayors, city councillors, and most importantly, individuals need to work together to provide clean air in our city, not just for us, but for our children and grandchildren. So please vote 1, George Razai for mayor, vote 1 for councillor, authorized by George Razai, Launceston.